The blood on his Boy Scout uniform wasn't the first thing I noticed. It was his eyes, wide, unfocused, darting around the emergency room like he was searching for someone who wasn't there. His lips moved constantly, forming words that came out in fragments, barely audible over the chaos of St. Halstead's Saturday afternoon rush. Tell her I'm sorry. He couldn't have been more than 14 years old. The khaki uniform with its merit badges and neckerchief was torn at the shoulder, dark stains spreading across the fabric. His right arm hung at an odd angle, and there was a gash above his left eyebrow that had bled down the side of his face, now dried and crusted. Son, who are you talking about? I asked, kneeling beside the wheelchair the paramedics had rolled him in on. Who needs to know you're sorry? His eyes finally focused on me, and what I saw there wasn't just pain. It was terror. Pure, primal terror. I should have listened. Tell her I'm sorry. Tell who? I pressed gently. Your mom? Your scout leader? But he'd already drifted away again, his gaze sliding past me to some invisible point beyond the ER walls, his broken arm cradled against his chest, his whole body trembling. The paramedic who'd brought him in, a stocky man named Derek, leaned close to me. Found him wandering on Riverside Trail, about 2 miles from the scout camp. Disoriented, possible head trauma, definitely a fractured arm. But here's the thing, Doc. We can't figure out what happened to him, and he won't stop apologizing to someone who isn't there. I looked back at the boy, at the fear etched into his young face, at the way he kept glancing toward the door like he expected someone, or something, to come through it at any moment. Tell her I'm sorry, he whispered again, and this time his voice broke. Please, before it's too late. But it would be hours before we understood who she was. And when we finally figured it out, when we pieced together what had really happened on that trail, the answer wouldn't just explain his injuries. It would lead us to someone else who was running out of time. My name is Dr. Noah Reyes, and I'm 5 months into my residency at Hospital St. Halstead. 5 months of learning that medicine is as much detective work as it is science, as much about listening to what patients don't say as what they do. It was a Saturday afternoon in late October. That perfect time of year when autumn has settled into its rhythm, but hasn't yet given way to winter's harsh grip. The leaves outside the hospital windows blazed orange and gold, and the temperature hovered in that comfortable range where you could wear a light jacket and feel perfectly content. Saturdays in the ER had their own particular rhythm. Fewer scheduled procedures meant more staff available, but it also meant more sports injuries, more outdoor accidents, more people who'd put off medical issues all week and finally decided to come in. The waiting room was full, but not overwhelming, a manageable, controlled chaos. I'd been rotating through emergency medicine for 6 weeks now, and I was starting to feel more comfortable with the pace. The constant triage, the rapid assessments, the need to make quick decisions based on incomplete information. It was so different from internal medicine floors, where you had time to think, to consider, to build a complete picture before acting. Dr. Patricia Okoye was the attending on duty, and I'd grown to deeply respect her clinical judgment and teaching style. She had this way of pushing you to think critically without making you feel stupid for not knowing something. Medicine is about pattern recognition, she'd told me during my first week. But the dangerous patterns are the ones we impose on patients rather than the ones we observe in them. I was at the nurse's station, finishing up paperwork on a sprained ankle case, when the radio crackled to life. St. Halstead, this is Medic 7. We're inbound with a 14-year-old male, found wandering on Riverside Trail near Camp Tomahawk. Visible injuries include probable radius fracture, laceration to the forehead, multiple contusions. Patient is alert but confused, repetitive speech, possible concussion, ETA 4 minutes. Camp Tomahawk. I knew it vaguely, a Boy Scout camp about 15 miles outside the city, situated in the state forest near the river. Popular spot for weekend camping trips and merit badge workshops. Copy that, Medic 7, the charge nurse responded. Bay 4 will be ready. I stood up, grabbed a fresh pair of gloves, and headed toward the trauma bay. Dr. Okoye appeared beside me, pulling her dark hair back into a quick ponytail. Pediatric trauma with confusion, she said. What's your differential? This was how Dr. Okoye taught, turning every case into a learning opportunity, asking questions that made you think through possibilities before you even saw the patient. Head injury is obvious, I said, thinking out loud. But confusion could be from the concussion itself or from something else. Hypoglycemia if he's diabetic. Toxic ingestion, drugs or alcohol, though he's pretty young for that. Seizure disorder with post-ictal confusion, or psychological trauma if something really bad happened to him. Good. Keep all those in your differential until you can rule them out. The ambulance bay doors burst open, and Derek and his partner wheeled in a gurney with a boy sitting upright in it, his young face pale beneath the dried blood, his scout uniform immediately recognizable with its distinctive patches and badges. "This is Tyler," Derek announced as they transferred him to the ER bed. "Tyler Chen, age 14, member of Troop 47. We found him about 30 minutes ago on Riverside Trail, approximately 2 miles from Camp Tomahawk." According to another hiker who called it in, Tyler was walking in circles, talking to himself, not responding clearly to questions. Tyler sat on the edge of the bed, his right arm cradled protectively against his chest. The arm was clearly deformed, a displaced fracture of the radius from the look of it. The gash on his forehead had stopped bleeding but would need stitches. His uniform was torn and dirty, with leaves and debris stuck to it, and those dark stains I'd noticed were definitely blood, though I couldn't tell yet if it was all his. But it was his eyes that caught my attention. They kept moving, scanning the room, searching for something or someone, and his lips kept forming those same words. "Tell her I'm sorry. Please, tell her I'm sorry." I approached slowly, keeping my voice calm and gentle. "Tyler, my name is Dr. Reyes. You're at St. Halstead Hospital. You're safe here. Can you tell me what happened?" His eyes locked onto mine for a moment, and I saw recognition there. He understood he was in a hospital, understood someone was trying to help him, but then that glazed look returned, and his gaze slid away. "I should have listened," he mumbled. "She said not to. I should have listened." "Who said not to, Tyler? Who are you talking about?" "Tell her I'm sorry. Tell her before." He stopped, his face contorting with pain and fear. "Is she okay? Please, you have to check if she's okay." Dr. Okoye stepped forward. "Tyler, we want to help whoever you're worried about, but first we need to know who she is. What's her name?" I can't." Tyler's breathing was getting faster, panic rising. "My head hurts. Everything's mixed up, but you have to tell her I'm sorry. You have to find her." "Okay, Tyler, we're going to help," Dr. Okoye said soothingly. "But right now I need you to help us understand. Where were you before you got hurt? What were you doing?" "Camp. We were at camp. Merit badge. I was working on my... He struggled to find the word, his face screwing up with concentration and frustration. "Your merit badge?" I prompted. "Yes. Wilderness survival. We were supposed to stay on the trail, but she wanted to see the... Again, he grasped for words that wouldn't come. His frustration was palpable, tears forming in his eyes. "It's okay, Tyler," I said. "Your brain got shaken up a bit. It's normal to have trouble finding words right now. We're going to help you." Rosa, one of our veteran nurses, was already taking vitals. BP 138/85, heart rate 102, temp 98.6, oxygen sat 97%, elevated but not critical. I began a systematic examination. His right forearm was definitely fractured, the classic dinner fork deformity of a collie's fracture, where the radius breaks and the hand angles backward. He winced when I gently palpated it, but he was surprisingly stoic about the pain. The forehead laceration was about 2 inches long, relatively clean edges, would need maybe 8 to 10 stitches. There were multiple bruises and scrapes on his arms and legs, consistent with a fall or tumble, but it was the neurological exam that concerned me most. His pupils were equal and reactive. That was good, but when I asked him to follow my finger with his eyes, there was a slight delay in his left eye's movement. His speech was halting, searching for words, and he couldn't tell me what day it was, where he was, or even what he'd been doing before the injury. "Tyler, I'm going to ask you some simple questions, okay? What's today's date?" "It's Saturday? I think it's Saturday." "That's right. Do you know what month it is?" He squinted, thinking hard. "October. We went camping because it's October and the weather is good." "Good. Can you tell me your address? Where you live?" His face went blank. I know this. I know where I live. He stopped, frustrated. "Why can't I remember?" This was more than just a simple concussion. The word-finding difficulty, the memory gaps, the continued confusion, these suggested a more significant traumatic brain injury. "Dr. Okoye," I said quietly, "I think we need a CT scan. He's got clear signs of TBI beyond just a concussion." She nodded, already pulling out her phone to order imaging. "Agreed. Also X-ray of that arm. And let's get a basic metabolic panel and blood glucose. I want to rule out metabolic causes for the confusion." Derek, the paramedic who'd brought Tyler in, was still standing nearby, finishing his paperwork. "Doc, there's something else you should know. When we found him, he had this in his pocket. He held up a clear evidence bag containing a small folded piece of paper, slightly crumpled and stained with what looked like blood. What is it? Dr. Okoye asked. We didn't want to open it and contaminate it, but you can see through the bag there's writing on it. Looks like maybe a note or something. Thought it might be relevant. Dr. Okoye took the bag, holding it up to the light. Through the translucent paper, I could make out handwriting, neat, feminine script. Only a few words were visible. Please don't tell. And further down, it's my fault. Tyler, Dr. Okoye said gently, do you know what this note is? Who wrote it? Tyler's eyes widened when he saw the paper, and his whole body tensed. That's hers. That's her note. You have to, oh God, you have to find her, please. Who? Tyler? What's her name? Emma. Her name is Emma, and she's... His voice dropped to a terrified whisper. She's still out there. She's hurt worse than me, and it's my fault. The room went silent. Everyone stopped what they were doing and looked at Tyler, then at each other. There's another injured child? Dr. Okoye asked, her voice sharp and urgent. Someone else is hurt? Where? At the place with the rocks. The big rocks by the water. She fell and I couldn't... I tried to help, but I fell too, and then I got confused, and I don't know if she... He was crying now, full body sobs. Please find her. Please tell her I'm sorry I left her. Derek pulled out his radio immediately. Medic 7 to dispatch. We need to notify the ranger station at Camp Tomahawk. Possible second injured miner in the woods near the camp. Location unclear. Patient indicates near rocks by water. Dr. Okoye grabbed my arm. Noah, stay with him. Get him stabilized and to imaging. I need to coordinate with emergency services. She was already moving toward her office, phone in hand. I turned back to Tyler, who was trembling, his good hand gripping the bed rail so hard his knuckles were white. Tyler, listen to me. People are going to look for Emma right now, but I need you to help us. Where exactly did this happen? Can you describe the place? The cliff, he said, the word coming out in a rush. There's a place where the trail goes up high and you can see the river. Emma wanted to get closer to the edge to take pictures. I told her not to, but she said it was safe. Then the ground just gave way. She fell, and I tried to grab her, but I couldn't. And then I went down after her trying to help. His breath was coming in gasps now, panic attack mixing with genuine terror and guilt. And you left her there? I asked as gently as I could. I didn't mean to, he cried out. I was going to get help. I was running back to camp, but then my head got all fuzzy and I couldn't remember which way was back and everything got confused. I kept walking and walking, but I was lost, and then those people found me and brought me here. Rosa put a reassuring hand on his shoulder. Tyler, honey, you did your best. You got help. That's what matters. But Tyler shook his head violently, then winced from the pain the movement caused. But I left her. She's alone and she's hurt, and what if she's... He couldn't finish the sentence. Couldn't voice the fear that was written clearly on his face. What if she's dead? I exchanged a look with Rosa. We were both thinking the same thing. If Emma had fallen from a cliff, if she'd been out there alone for however long Tyler had been wandering confused, if the fall had been serious enough, the chances weren't good. Tyler, I said, crouching down to his eye level, I need you to focus for me. This is really important. How long ago did Emma fall? When did this happen? He struggled to think, his face contorting with the effort. We went hiking after lunch. We had sandwiches at camp and then we left maybe around 1 o'clock. We were supposed to be back by 4 for the evening program. I glanced at the clock on the wall. It was 3:47 p.m. So, this happened sometime in the last 2 or 3 hours? I think so. I don't know. Everything's mixed up. 2 or 3 hours. That was a long time to be injured and alone in the woods, but it also meant there was still hope. Still a chance they'd find her alive. Dr. Okoye returned, her face set in that expression of controlled urgency I'd come to recognize. Park rangers are mobilizing a search team. They're starting at the trail coordinates where Tyler was found and working backward. Local SAR, Search and Rescue, has been notified and they're dispatching. But Noah, we have a problem. What? There are multiple cliff areas along that trail system. Without a more specific location, they're looking at potentially miles of terrain to cover. And we're losing daylight. Sunset is around 6:30. That gives them less than 3 hours of good light. She looked at Tyler with compassion and professional determination. Tyler, I know this is hard, but I need you to tell us everything you can remember about where you were. Every detail matters. Someone's life depends on it. Tyler closed his eyes, tears streaming down his face. I'm really trying, but my head Everything's so confused. Start with what you remember clearly, I prompted. You and Emma left camp around 1 o'clock. Were you on a marked trail? Yes, the blue trail. It's marked with blue painted blazes on the trees. Good. That's good, Tyler. What else? We walked for maybe 30 minutes? There was a stream we had to cross. We used the stepping stones. Emma almost slipped, but she caught herself and we laughed about it. Despite his fear and pain, a small smile flickered across his face at the memory, then disappeared. After the stream, the trail went uphill. It got steeper. Emma was getting tired, but she wanted to keep going. She said her older sister had told her about this amazing view, and she wanted to see it, wanted to take pictures to show her troop. Emma's in Scouts too? Rosa asked gently. Girl Scouts. Different troop. We go to the same school. He paused, and even through his confusion and pain, I could see a hint of something else. An adolescent crush, perhaps, the way he said her name. She's really brave. She's not afraid of anything. That's why she wanted to go to the edge. She wasn't scared. So you reached the top of the hill, and there was a cliff. I guided him back to the crucial details. Not at first. There was a flat part where you could see out over the trees. The river was way down below, like really far. It was beautiful. Emma took pictures. But then she saw there was a ledge, like a rock that stuck out even further, and she wanted to get a picture from there. His breathing quickened again, reliving the moment. I told her not to. I said it looked dangerous. The rocks might be loose. But she said I was being paranoid, that it was fine. She went out there and it was okay at first. She was taking pictures and laughing. But then she wanted to get even closer to the edge to look straight down, and that's when it happened. The ground gave way? Dr. Okoye asked softly. Tyler nodded, fresh tears falling. There was this cracking sound, and then the rock just broke off and she fell. She screamed and grabbed for something, but there was nothing to grab, and she just went over. He was shaking now, his whole body trembling with the memory and the shock. How far did she fall, Tyler? Could you see her after she went over? I ran to the edge, a different part that seemed more solid, and I looked down. She'd fallen onto another ledge, maybe 15 feet down. I could see her. She wasn't moving. There was blood on the rocks. I called her name, but she didn't answer. 15 feet. That was survivable, depending on how she landed. But serious injuries were almost certain. And if she'd been unconscious for hours, what did you do then? I asked. I tried to climb down to her. There were rocks and roots I could use like a ladder. But I was rushing and I was scared and I wasn't being careful. I got about halfway down and my foot slipped and I fell the rest of the way. I landed on my arm. He gestured to his obviously broken forearm. And hit my head on something. Everything went black for a minute. You lost consciousness? Dr. Okoye asked sharply. That was significant. I think so. When I woke up, Emma was right there next to me. She was awake, her eyes were open, and she was trying to talk, but her voice was really quiet. She said she couldn't move her legs. My stomach dropped. Spinal injury. That's what she was describing. If Emma had fallen and landed in a way that injured her spine, if she'd been lying there unable to move for hours, she could talk though? I asked. She was conscious? Yeah, but she was really scared. She kept asking me what happened and saying she couldn't feel her legs and crying. I tried to help her, but I was dizzy and my arm hurt so bad. I took off my neckerchief. He gestured to his torn uniform where the Boy Scout neckerchief should have been, and tried to stop some of the bleeding from a cut on her head. But she kept bleeding and I couldn't make it stop. Where was she bleeding from, Tyler? Just her head? Her head and her back. I think she hit a sharp rock when she landed. The back of her shirt was all torn, and there was so much blood. This was getting worse by the second. Potential spinal injury, significant blood loss, hours of exposure. Possibly hypothermic by now, given the cooling October weather. Tyler, this is really important, Dr. Okoye said, her voice urgent but controlled. Did Emma give you that note? The one in your pocket? Tyler looked confused. Note? I don't remember a note. Dr. Okoye held up the evidence bag again. This. It was in your pocket. The writing looks like a girl's handwriting. Tyler stared at it, his face going even paler. She must have. When I was leaving to get help, she said something about not telling someone something, but I couldn't understand her. She was getting really sleepy and her words weren't making sense. She said I had to promise something, but I don't remember what. He started crying harder. I tried to stay with her. I really did. But I thought if I could get back to camp, I could bring help back faster. So I started climbing back up to the trail. But when I got to the top, everything was spinning and I couldn't remember which way was back to camp. I just started walking, and then everything's fuzzy until those people found me and called you. Dr. Okoye's phone rang. She answered it, listened intently, her expression growing grimmer. Understood. Keep me updated. She hung up and looked at us. Search and rescue has reached the area Tyler described, a cliff overlook on the Blue Trail system. But Noah, there's a problem. There are 2 different scenic overlooks along that trail, both with cliff faces, both overlooking the river. They're about a mile apart. The teams are splitting up to search both locations, but that divides their resources and slows everything down. She turned back to Tyler. Tyler, was there anything distinctive about the place where you fell? Anything that would help them identify which location it is? Tyler squeezed his eyes shut, trying to think through the fog of his traumatic brain injury. There was a tree, a big dead tree right at the edge. It was like white and bare, no bark, just white wood. It looked like skeleton fingers reaching up. Dead tree, Dr. Okoye repeated, typing into her phone. That's something. Anything else? Birds, Tyler said suddenly. There were birds flying around below us, like circling. Emma said they were turkey vultures. She knows all about birds. She's working on her bird-watching badge. Turkey vultures, scavenger birds that soared on thermals looking for carrion or injured prey. Dr. Okoye relayed the information. Then she looked at me. Noah, get him to imaging now. We need to see what we're dealing with in terms of his brain injury. And get that arm x-rayed. Rosa, let's type and cross him just in case and keep that IV running. I want him hydrated and ready if we need to move fast. Move fast for what? I asked. If they find Emma alive, they'll airlift her here. It's the closest level 1 trauma center. And if her injuries are as serious as Tyler's describing, we're going to need everyone on deck. She paused, her dark eyes serious. But Noah, you need to prepare yourself. If she's been out there for 3 hours with spinal injuries and uncontrolled bleeding, the chances she's still alive are dropping with every passing minute. I nodded, understanding the grim reality. Then I looked at Tyler, at this 14-year-old boy in his torn Boy Scout uniform, trying to be brave while his world fell apart. Tyler, I said gently, we're going to take care of you, and they're going to find Emma. You did the right thing by getting help. But what if I was too late? He whispered. What if she's gone because I got confused and lost and took too long? I didn't have an answer for that, because the truth was, he might be right, and we wouldn't know until they found her. Tyler's CT scan showed what I'd feared, a moderate traumatic brain injury with a small subdural hematoma and significant brain swelling. Nothing that required immediate surgery, but serious enough that he'd need close monitoring in our ICU. The confusion, the word-finding difficulty, the memory problems, they all made sense now. His arm X-ray confirmed a displaced distal radius fracture that would need reduction and casting by orthopedics. But through all the imaging and treatment, Tyler kept asking the same question. Did they find her yet? Did they find Emma? And for 45 agonizing minutes, the answer was no. I was in the casting room with Tyler and the orthopedic resident when Dr. Okoye appeared in the doorway, her phone pressed to her ear, her expression impossible to read. Yes, I understand. We'll be ready. She hung up and looked at me. They found her. Tyler sat bolt upright despite the half cast on his arm. Is she alive? Please tell me she's alive. Dr. Okoye's face softened. She's alive, Tyler. They found her exactly where you said she'd be. She's hurt. She's in serious condition, but she's alive. They're airlifting her here now. ETA 12 minutes. The relief that washed over Tyler's face was so profound, I thought he might pass out. He started sobbing, deep, racking sobs of relief and residual fear and exhaustion. She's alive, he kept repeating. She's really alive. But I was watching Dr. Okoye's face, and I could see there was more to the story, something she wasn't saying in front of Tyler. Finish up here, she said to the ortho resident, then gestured for me to follow her into the hallway. Once we were out of Tyler's earshot, her expression changed to one of grave concern. She's alive, but barely, Dr. Okoye said bluntly. Significant head trauma, spinal injuries, substantial blood loss. Glasgow coma scale of 7 when they found her. She's hypothermic, core temp of 93 degrees. They've intubated her in the field and she's being flown in hot. GCS of 7. That was bad. Glasgow coma scale runs from 3 to 15, with 15 being fully awake and oriented. 7 meant she was barely responsive, in danger of her airway collapsing, her brain potentially herniating from swelling or bleeding. Spinal injuries? I asked. They've got her fully immobilized, but yes, The paramedics noted decreased sensation and movement in her lower extremities. Could be from direct spinal trauma or from swelling. We won't know until we image her. The bleeding? Controlled for now, but she's lost a lot of blood. They estimated at least 2 units based on the scene. We're activating the massive transfusion protocol and getting the OR ready just in case. She checked her watch. 10 minutes now. I'm calling in neurosurgery and orthopedic spine. This is going to be an all-hands situation. As Dr. Okoye walked away making calls, I stood in the hallway trying to process it all. A 14-year-old girl had been lying broken on a ledge in the woods for 3 hours, slowly bleeding out, unable to move, probably terrified beyond measure. But she'd survived. Against the odds, she'd held on long enough to be found. I thought about the note in Tyler's pocket, the one we still hadn't opened and read completely. What had Emma written? What had been so important that she'd used what might have been her last moments of consciousness to write it down and give it to Tyler? Rosa found me in the hallway. Dr. Reyes, the family is here. Emma's family? No, Tyler's. His parents just arrived. They're in the waiting room and they're terrified. Someone needs to talk to them. Right. Of course, Tyler had parents who'd been called, who'd rushed to the hospital in a panic thinking their son was seriously injured or worse. I found them in the waiting room. A Chinese-American couple in their 40s, the father in business casual clothes like he'd come from the office, the mother in yoga pants and a sweatshirt like she'd been home doing weekend chores when she got the call. They stood when they saw my white coat approaching. Doctor, Reyes? The father asked, his voice tight with worry. You're treating Tyler? I am, Mr. Chen. Tyler is going to be okay. He has a broken arm and a concussion. Actually, a moderate traumatic brain injury. But he's stable and alert, and we're taking good care of him. The relief on their faces was immediate, tears flowing down the mother's face. Thank God, she whispered. When they called us and said he'd been airlifted from the woods, we thought, I understand. It's frightening. But Tyler was very brave and he's going to recover fully. His arm will need a cast for about 6 weeks, and the head injury will take time to heal. He'll need to avoid sports and activities for a while, but his prognosis is excellent. Can we see him? The father asked. Of course, but first I need to explain something. I led them to a quiet corner of the waiting room and sat down with them. Tyler wasn't alone when he got injured. There was a girl with him, Emma. They were hiking together when they fell from a cliff. Emma was hurt much worse than Tyler, and she's being airlifted here right now. Mrs. Chen's hand went to her mouth. Oh my God, Emma Rodriguez? From his school? I don't know her last name yet, but Tyler has been very worried about her, asking about her constantly. He feels responsible for what happened. Emma Rodriguez, Mrs. Chen confirmed. They're friends, good friends. Tyler talks about her all the time. She's in Girl Scouts, very outdoorsy, very adventurous. Is she? She's alive, I said, but she's critically injured. I wanted you to know because Tyler is going to be very focused on her condition, and he's going to need support dealing with what happened. Mr. Chen nodded slowly. They went off trail, didn't they? Tyler's troop leaders are very strict about staying on marked trails. They would have gone on their own. It appears they may have taken a detour to see a scenic overlook, I said carefully, not wanting to assign blame, but needing to be honest. That sounds like Emma, Mrs. Chen said, not unkindly. She's a wonderful girl, but she's very bold, very confident, sometimes too much so. And Tyler, she paused, choosing words carefully. Tyler likes her, a lot. He would have followed her anywhere. The classic teenage dynamic. A boy wanting to impress a girl, not wanting to seem scared or cautious. A girl confident enough to push boundaries, not recognizing the real danger. And both of them paying a terrible price for that combination. You can see Tyler now, I said. He's in the casting room getting his arm set, but please be aware he's very emotional and his thinking is a bit confused from the head injury. He may repeat himself or have trouble finding words. That's normal for now and should improve over the next few days. I led them back to where Tyler was, and the reunion was emotional. Tears and hugs and reassurances. I stepped back to give them privacy, but I heard Tyler immediately ask, Did Dr. Reyes tell you about Emma? They found her, Mom. She's alive. Before his mother could respond, the overhead speakers crackled to life. Trauma team to the helipad. Trauma team to the helipad. ETA 2 minutes. That was Emma. I left Tyler with his parents and ran toward the elevator that led to the rooftop helipad. Dr. Okoye was already there along with a full trauma team, 2 other residents, 3 nurses, a respiratory therapist, and the trauma surgery attending, Dr. William Saunders. The wind from the approaching helicopter hit us first, then the deafening roar of the rotors. The medical helicopter settled onto the pad with practiced precision, and before the rotors even fully stopped, the side door slid open and paramedics were pulling out a stretcher. The girl on it looked impossibly small and fragile. She was fully immobilized on a backboard, a cervical collar around her neck, a breathing tube down her throat connected to a bag valve mask that a paramedic squeezed rhythmically. Her face was bruised and swollen, caked with dried blood. Her clothes had been cut away, replaced with trauma blankets, but I could see bandages covering wounds on her head and torso. 14-year-old female, fall from height approximately 15 feet, the flight paramedic called out as we rushed the stretcher toward the elevator. Multiple trauma, head injury with decreased GCS. We intubated on scene. Suspected spinal injury with decreased lower extremity function. Large laceration to posterior scalp and upper back, significant blood loss. We've transfused 1 unit O-neg in flight. Vitals BP 88/52, heart rate 118, hypothermic at 93.2 degrees. 2 large bore IVs running wide open. We crashed through the doors into the trauma bay. The well-choreographed chaos of a major trauma activation unfolded. Everyone had their role. Everyone knew exactly what to do. On my count, Dr. Saunders commanded. 1, 2, 3. We transferred Emma from the helicopter stretcher to the trauma bay bed, maintaining spinal precautions throughout. I need a chest x-ray, pelvis, C-spine, Dr. Saunders called out. Get me 4 units of blood on standby. Start warm fluids through a rapid infuser. Someone get a warming blanket on her. And get me a fast exam. I want to make sure there's no internal bleeding. I took my position and started my part of the secondary survey, examining her extremities while others handled the more critical elements. Her legs showed multiple abrasions and contusions, but no obvious fractures. But when I tested sensation and motor function, running a pen along her feet, asking if she could feel it, of course knowing she was intubated and couldn't respond, there was no reflexive movement, no pulling away. Decreased sensation and motor function in lower extremities confirmed, I announced. Dr. Okoye was examining the head injury. Large posterior scalp laceration, approximately 6 inches long down to skull. I can see bone. Going to need extensive irrigation and closure. Pupils equal and sluggishly reactive. Could be from the head injury or from medications given during transport. The x-rays were done quickly, images popping up on the screens around the room. No obvious chest injuries. Pelvis intact. But the C-spine film made everyone pause. There, Dr. Saunders pointed. T12L1. You can see the fracture. The vertebrae in the middle of her back, right at the transition from thoracic to lumbar spine, showed a compression fracture. The bone had been crushed by the force of her landing. That explains the paralysis, Dr. Okoye said grimly. We need neurosurgery and spine surgery now. Already paged, one of the nurses confirmed. Dr. Martinez from Neurosurg is on her way. The team continued their systematic assessment. The FAST exam, a rapid ultrasound to check for internal bleeding, was negative, which was good news. Her abdomen was soft, no signs of damage to internal organs. But the hypothermia was concerning, and despite warming blankets and warm IV fluids, her temperature was climbing slowly. Blood pressure dropping, one of the nurses announced, 82/48. Push more fluids and hang the first unit of blood, Dr. Saunders ordered. Her body can't compensate anymore. She's going into hypovolemic shock from blood loss. I watched the team work, feeling somewhat helpless in my limited role. This was beyond my skill level. This was major trauma, requiring specialists and experience I didn't have. But I could observe, I could learn, and I could do the small tasks assigned to me. Dr. Martinez arrived, the neurosurgeon who'd been on call. She was a small woman with sharp eyes and steady hands, and she went immediately to the imaging screens. Compression fracture T12L1, she said, assessing quickly. With neurological deficit, she's going to need surgical stabilization. But first we need to see if there's any spinal cord swelling or bleeding. Get me an MRI. She's not stable enough for MRI, Dr. Saunders countered. Blood pressure is marginal. We're transfusing. She could crash at any moment. We need to get her stabilized first. Then stabilize her fast because the longer we wait, the more permanent damage is occurring to her spinal cord. Every minute counts. It was a medical dilemma. Emma needed surgery on her spine urgently to have any chance of recovering function in her legs, but she also needed to be stable enough to survive the surgery. And right now, with her blood pressure dropping and her body hypothermic and in shock, she was a surgical disaster waiting to happen. Get her core temp up and her pressure stabilized, Dr. Martinez said. You've got 30 minutes. Then she's going to the OR whether you like it or not. Because if we don't decompress that spinal cord soon, she's going to be paralyzed for life. The next 30 minutes were a blur of controlled urgency. More blood products, more warm fluids, heating blankets above and below her, a warming device that blew heated air through a special blanket, medications to support her blood pressure. Slowly, gradually, Emma's vital signs began to improve. Temperature climbed to 95 degrees, then 96. Blood pressure stabilized at 102/64. Heart rate slowed from the 120s to the 90s. Good enough, Dr. Martinez declared. Let's move. OR 3 is ready. They wheeled Emma out of the trauma bay towards surgery, a full team accompanying her, ready to respond if she crashed en route. Dr. Okoye and I stood in the now quiet trauma bay, blood-stained gauze and empty equipment wrappers scattered around us, the detritus of the organized chaos that had just occurred. That girl is fighting hard, Doctor, Okoye said quietly. 3 hours on that ledge, hypothermic, bleeding, unable to move. Most people wouldn't have survived. Will she walk again? I asked. Too soon to know. Depends on the extent of spinal cord damage, how successful the surgery is, how much recovery function returns. But Noah, even if she survives this, even if the surgery goes perfectly, she's looking at months of rehabilitation. She's 14 years old and her life just changed forever. I thought about Tyler, about his desperation to apologize to Emma, his guilt over what had happened. Dr. Okoye, the note, the one Tyler had in his pocket. Should we read it now? She pulled out the evidence bag from her pocket where she'd stored it. Let's see what was so important that Emma used possibly her last conscious moments to write it. We carefully opened the bag and unfolded the blood-stained paper. The handwriting was shaky but legible, the words of a girl who knew she might be dying. The full note read, Tyler, if something happens to me, please don't tell my parents I came here. Tell them we stayed on the trail like we were supposed to. They can't know I broke the rules. They already think I'm too reckless. This will destroy them. Tell them it was an accident on the regular trail. Please, it's my fault, not yours. You tried to stop me. I'm so sorry I didn't listen. If I don't make it, tell my little sister Maya I love her and to be smarter than me. Tell her to listen when people say something is dangerous. I'm really scared. Emma. I read the note twice, feeling my throat tighten with emotion. This girl, lying broken and alone on a cliff ledge, had been worried not about herself, but about protecting her parents from additional pain, about making sure her sister learned from her mistake. She thought she was going to die, I said quietly. Most people in that situation would think that, Dr. Okoye said, but she used that time to try to protect the people she loved. That tells you something about her character. Tyler's been trying to deliver this message. Even with a traumatic brain injury, even confused and in pain, he remembered that Emma wanted him to tell someone she was sorry. We need to get this to Emma's family, Dr. Okoye said. They're probably in the surgical waiting room by now. But Noah, we need to think about whether we show them this note. What do you mean? Emma asked Tyler not to tell her parents the truth about where they were. She wanted them to believe it happened on the regular trail. But now there are going to be official reports, search and rescue reports, ranger reports, hospital documentation. The truth is going to come out regardless. The question is whether we respect Emma's dying wish or whether we're honest with her family about what happened. It was an ethical dilemma with no clear right answer. Respect the patient's expressed wishes or provide full honesty to the family? Let's talk to the family first, I suggested. See what they know, see what they're dealing with, then we can decide. We found Emma's parents in the surgical waiting room, along with a younger girl who had to be Maya, Emma's sister. The parents were both Latino, the mother with tear-stained cheeks, the father looking shell-shocked. Maya, who looked about 10 or 11, sat between them holding both their hands. Mr. and Mrs. Rodriguez? Dr. Okoye approached them gently. I'm Dr. Okoye, this is Dr. Reyes. We've been treating Emma. How is she? Mrs. Rodriguez asked immediately, her voice breaking. They said she fell, that she's badly hurt. How bad? Dr. Okoye sat down across from them, her manner compassionate but professional. Emma has serious injuries. She has a head injury, some bleeding that we've controlled, and most significantly, she has a fracture in her back that has affected her spinal cord. She's in surgery right now, and the neurosurgeon is working to stabilize the fracture and relieve pressure on the spinal cord. The spinal cord, Mr. Rodriguez repeated slowly, processing. Does that mean? It means her legs aren't working right now. Whether that's temporary or permanent, we won't know for some time. It depends on many factors. The extent of the damage, how successful the surgery is, how her body heals. But I want to be honest with you. This is a very serious injury. Mrs. Rodriguez dissolved into sobs. Maya, the younger sister, looked up at her parents with wide, frightened eyes. "How did this happen?" Mr. Rodriguez asked, his voice hardening. "They told us there was a fall during a scouting activity. Was someone not supervising properly? Was this negligence?" Dr. Wainas, Okoye and I exchanged glances. Here was the moment. Tell them what Emma wanted them to believe, or tell them the truth. "Mr. Rodriguez, Emma wasn't at an official scouting activity when this happened," Dr. Okoye said gently. "She was hiking with a friend, another young person from her school, Tyler Chen. He's also a patient here with less serious injuries." "Tyler?" Mrs. Rodriguez looked up, confused. "Emma said she was going to the scout camp today for a wilderness survival workshop. She had her uniform on and everything. The camp is nearby, but it appears Emma and Tyler went hiking on their own, separate from any supervised activity." "That doesn't make sense," Mr. Rodriguez said. "Emma knows better than to go off alone in the woods. We've talked to her about safety 100 times. She wouldn't..." He stopped, realization dawning on his face. "She lied to us. She told us she was going to a scout activity, but she actually went hiking with a boy." The anger and hurt in his voice was painful to hear. His daughter was in surgery fighting for her life, and now he was learning she'd deceived him about where she was going. "Mr. Rodriguez, I know this is difficult," I said carefully, "but teenage judgment isn't always perfect. Emma and Tyler made a decision that had serious consequences, but they weren't being malicious. They were just being kids who wanted an adventure. An adventure that may have cost my daughter the use of her legs," he said bitterly. "Honey," Mrs. Rodriguez put a hand on his arm, "Emma's alive. That's what matters. We can deal with everything else, but she's alive." Maya, who'd been quiet until now, spoke up in a small voice. "It's my fault." Everyone turned to look at her. "What do you mean, mija?" Mrs. Rodriguez asked. "I told Emma about the pretty view from the cliff trail. I went there last year on a field trip, and I showed Emma pictures. She said she wanted to see it someday. I told her how to find it." Tears started rolling down her face. "It's my fault she went there." "Oh, sweetheart, no." Mrs. Rodriguez pulled Maya into a hug. "This is not your fault. Not at all." But I could see the guilt on the young girl's face. The same guilt Tyler was carrying. Both of them blaming themselves for Emma's injuries. Dr. Okoye's phone buzzed. She checked it, then looked up. That was the OR. The surgery is going to take several hours. They're stabilizing the spinal fracture with rods and screws, and they're also addressing the head injury. Dr. Martinez will come speak with you when she's done, but it's going to be a while. After answering more of their questions and providing what comfort we could, Dr. Okoye and I stepped away. "We didn't show them the note," I observed. "No, and I don't think we should. Emma was worried about protecting her parents from pain, from feeling like they'd failed as parents, from blaming themselves. Showing them a note where she explicitly asks Tyler to lie to them? That would only add to their anguish." "But they have a right to know what Emma's last conscious thoughts were," I argued. "They have a right to know she was thinking of them, trying to protect them." "Or," Dr. Okoye countered, "we respect Emma's wishes. She didn't want them to see that note, to know she'd considered dying, to carry the guilt she tried to spare them. Sometimes the kindest thing we can do is protect people from knowledge that will only hurt them." I thought about that, about medical ethics and patient autonomy and family rights. There were no easy answers. "Let's table it for now," Dr. Okoye decided. "Emma survived. She's in surgery. When she wakes up, and she will wake up, we can ask her what she wants us to do with the note. Let her make that decision when she's able to." It seemed like a reasonable compromise. I went back to check on Tyler, who'd been admitted to a room and was resting with his parents beside him. They'd clearly told him that Emma was in surgery, and while he was worried, there was also visible relief on his face that she'd been found alive. "Dr. Reyes," Tyler said when he saw me. His speech was clearer now, the acute confusion from his brain injury settling as his brain began to recover. "Did you tell Emma's parents? Did you tell them I'm sorry?" "Tyler, Emma's parents know you were with her. They know you tried to help. No one blames you. But I should have stopped her from going to the edge. I knew it was dangerous. I should have made her listen." Mrs. Chen stroked her son's hair gently. "Tyler, you can't control other people's choices. Emma made her own decision, but I went with her. I could have said no, could have refused to go. Then maybe she wouldn't have gone either." It was the classic counterfactual thinking that followed any trauma. The endless what-ifs, the replaying of decisions, the search for the moment where a different choice might have prevented disaster. "Tyler," I said, Emma wrote you a note. She gave it to you before you left to get help. Do you remember? He thought hard, his face scrunching with concentration. Maybe? Everything's really fuzzy. What did it say? She said it wasn't your fault. She said you tried to stop her and she didn't listen. She took responsibility for what happened. His eyes filled with tears. She did? Yes. And she asked you to tell her little sister to be smarter than her, to listen when people say something is dangerous. Can I see it? Can I see the note? I hesitated. The note was evidence, technically, and it contained things Emma might not want shared. But Tyler had carried that message, had fought through his own confusion and injury to try to deliver it. He deserved to know what it said. Let me check with Dr. Okoye, I said. But Tyler, I want you to understand something. What happened today was a tragic accident. You made a choice to go with Emma, but you also made a choice to try to save her. You climbed down to help her, injured yourself in the process, and then went for help even though you were hurt and confused. You're a hero, not a villain. I don't feel like a hero, he said quietly. I feel like an idiot. His father spoke up then. Son, heroes aren't people who never make mistakes. Heroes are people who try to fix their mistakes, who try to help others even when they're scared or hurt themselves. You did that. You got help for Emma. If it weren't for you, she might not have been found in time. Tyler absorbed that, wanting to believe it, but still carrying the weight of guilt. I left them and went to find Dr. Okoye. The ER had returned to its normal rhythm. The trauma had passed, new patients were arriving, the cycle continued. But I couldn't stop thinking about Emma in surgery, about Tyler consumed with guilt, about two teenagers whose lives had changed forever in one moment of poor judgment. Dr. Okoye was in her office, finishing paperwork. How's Tyler? Physically healing, emotionally devastated. He wants to see the note. She considered that. I think that's reasonable. It was given to him after all. He has a right to read it fully. But let's make a copy first. The original should be kept in case anything legal comes up. You think there could be legal issues? 2 unsupervised minors went off trail. One ended up with potentially life-changing injuries. Parents might want to blame someone. The camp, the rangers, anyone. I'm not saying they will, but we need to protect everyone involved. She made a copy of the note, then gave me the copy to bring to Tyler. And Noah, when this case is over, when Emma and Tyler are both recovered, we need to present this at M&M. There are lessons here about pediatric trauma, about the cascade effect of injuries, about resource coordination with search and rescue, but also about the psychology of adolescent risk-taking, about how we support young patients dealing with trauma and guilt. I took the copied note back to Tyler's room. His parents had stepped out for a moment, giving me a chance to speak with him privately. Tyler, here's Emma's note. This is what she wrote to you. He took the paper with his good hand and read it slowly, his lips moving slightly as he processed each word. When he finished, tears were streaming down his face. She tried to protect her parents, he said. Even when she thought she might die, she was trying to protect them. That's who Emma is, I said. Someone who thinks about others, even in her darkest moment. I have to tell them, Tyler said suddenly. I have to tell her parents the truth. She asked me to lie, but I can't. They deserve to know what really happened. Tyler, that's a big decision. Emma explicitly asked you not to. I know, but it's not right. They're going to find out anyway from the rangers and the reports. And they should hear it from me, from someone who was there. Emma's my friend. I owe her parents the truth. There was a maturity in his voice, a recognition that sometimes honoring someone means not doing exactly what they asked, but doing what's right. Okay, I said. When you're ready, we can arrange for you to talk to them. But Tyler, you need to understand. They might be angry. They might blame you, at least initially. You need to be prepared for that. I know, but I still have to do it. Emma's surgery lasted 5 hours. Dr. Martinez emerged looking exhausted, but cautiously optimistic. The surgery went well, she told Emma's parents. We stabilized the fractured vertebrae with rods and screws. There was some swelling of the spinal cord which we addressed, and we cleaned and closed the scalp laceration. Emma's stable and she's being moved to the ICU. Will she walk again? Mr. Rodriguez asked, the question they'd all been dreading. It's too early to say, Dr. Martinez answered honestly. There was no complete transection of the spinal cord. It's not severed, which is good news, but there was significant compression and swelling. Some patients with this type of injury recover full function. Some recover partial function. Some remain paralyzed. We won't know which category Emma falls into until the swelling goes down, and we can assess her neurological function over the next several days and weeks. What's the best case scenario? Mrs. Rodriguez asked. Best case, the paralysis was entirely from swelling and temporary trauma to the cord. As the swelling goes down, nerve function returns, and with physical therapy, she makes a full recovery. That does happen. And worst case? Worst case, there was permanent damage to the nerve fibers and she has persistent paralysis of her lower extremities. But even then, there's a spectrum. Some sensation but no movement. Some movement but not enough for walking. Partial function that improves with therapy. We're going to do everything we can to optimize her chances, but some of this is beyond our control. The body has to heal. After Dr. Martinez left, I stayed with the family, answering questions, providing support. Maya, the little sister, sat quietly, processing everything in the way children do, absorbing but not fully understanding the magnitude. Dr. Reyes, Mrs. Rodriguez said at one point, Tyler, the boy who was with Emma, is he okay? He is. Broken arm, concussion, but he'll recover fully. Can we see him? I'd like to talk to him, find out exactly what happened. This was the moment Tyler had asked for, but I still wanted to make sure he was prepared. Tyler actually wants to talk to you as well, I said. But Mrs. Rodriguez, Mr. Rodriguez, I need to ask you to remember that Tyler is also a patient, also a child, and he's carrying a tremendous amount of guilt about what happened. He needs compassion right now, not anger. Mr. Rodriguez's jaw tightened. I can't promise I won't be angry. My daughter may never walk again because of a choice these kids made. I understand, but Tyler didn't cause the fall. He actually tried to prevent it. And after Emma fell, he tried to save her. He climbed down to help her, got injured himself, and then went for help even though he was confused and lost. Emma might not be alive right now if it weren't for Tyler's actions. That seemed to soften Mr. Rodriguez slightly. All right, we'll talk to him. I brought them to Tyler's room. Tyler's parents were there, and when the two sets of parents met, there was an awkward moment of not knowing what to say. Then Mrs. Chen stepped forward and embraced Mrs. Rodriguez. I'm so sorry about Emma, she said, her voice thick with emotion. We've been praying for her. Thank you, Mrs. Rodriguez managed. Tyler sat up straighter in his bed, his casted arm resting on his lap, his face pale but determined. Mr. and Mrs. Rodriguez, he said, his voice shaking slightly. I need to tell you what happened, the truth, and he did. He told them everything, how Emma had wanted to see the scenic overlook, how he'd tried to talk her out of going to the edge, how the ground had given way, how he'd tried to save her, how he'd gotten lost trying to find help. He told them about Emma's last conscious moments, about how she'd been scared, but had still tried to write them a message. He didn't show them the actual note, that felt too private, but he told them what it said. She asked me to lie to you, Tyler said, tears streaming down his face. She asked me to tell you it happened on the regular trail, that we'd followed the rules. She was trying to protect you, but I can't lie. You deserve to know the truth. And the truth is that Emma made a bad choice, and I went along with it. And she got hurt because of that choice. I'm so sorry. The room was silent for a long moment. Then Mrs. Rodriguez stepped forward and did something unexpected. She hugged Tyler. Thank you for telling us the truth, she said softly. And thank you for trying to save our daughter. Thank you for not leaving her alone. Mr. Rodriguez was slower to come around, but eventually he too shook Tyler's hand. You made a mistake, but you tried to make it right. That takes courage. After they left, Tyler collapsed back against his pillows, emotionally exhausted. His mother held his good hand. I'm proud of you, she said. That was very brave. I just did what I had to do, Tyler said. Emma deserved the truth. Emma woke up 36 hours after surgery. I wasn't there for the moment. I was on a different rotation by that point. But Dr. Okoye called me to let me know. She's awake, she's oriented, and her parents are with her. But Noah, she's asking about Tyler. She wants to know if he's okay. Even after everything, she's worried about him? That's what her mother said. First coherent thing Emma asked after waking up was whether Tyler had made it back safely. I went up to the ICU to check on her, getting permission from her parents first. Emma was propped up in bed, intubation tube removed, breathing on her own through an oxygen mask. Her head was bandaged, her face still bruised and swollen, but her eyes were clear and alert. Emma, I said gently, I'm Dr. Reyes. I was part of the team that treated you when you arrived. Tyler, she said immediately, her voice hoarse from the breathing tube. Is Tyler okay? He's fine. Broken arm, concussion, but he'll heal completely. The relief on her face was palpable. I was so scared. When he left to get help, he was confused and dizzy. I thought he might not make it back, might get lost or hurt worse. He did get lost, I admitted, but he kept going until he found help. Emma, Tyler saved your life. If he hadn't gotten to rescuers when he did, if they'd started searching any later, you might not have made it. I need to see him. Can I see him? Not just yet. You need to stabilize more first. But Emma, there's something we need to talk about. Your legs. I know, she interrupted, her voice dropping. I can't feel them. I can't move them. The doctor already told me. Dr. Martinez, your surgeon, says there's a chance feeling and movement will return as the swelling goes down, but it's going to take time, and we don't know yet what your recovery will look like. Emma stared at the ceiling, processing this. She was 14 years old, an age when your body is everything. Athletics, dance, just running around with friends, and now she was facing the possibility that her legs might never work again. It's my fault, she said quietly. Tyler tried to warn me. He said the edge looked dangerous, but I didn't listen. I never listen. Emma, accidents happen. Yes, you made a choice that had consequences, but you're alive. You have a chance to heal, to recover, to move forward. That's what matters now. Is Tyler mad at me? Does he hate me for getting him hurt? No, Emma. Tyler doesn't hate you. He's been consumed with worry about you. He feels guilty because he thinks he should have stopped you more forcefully, should have refused to go with you. That's stupid, Emma said, a flash of her personality showing through. I'm the one who insisted. He tried to stop me. None of this is his fault. You should tell him that. When you're both well enough, you should talk to each other. I think you both need to hear that the other doesn't blame them. Over the next few days, both Emma and Tyler continued to heal. Tyler's confusion cleared as his brain injury resolved. His arm would take weeks to heal, but his cognitive function returned to normal. Emma's physical healing was more complicated. The scalp wound was healing well. The spinal surgery site was clean and showed no signs of infection, but her legs remained motionless, unresponsive to commands to move, to sensation tests. On the 4th day after her surgery, the physical therapy team did their first assessment. I was there, watching, as they tested every aspect of lower extremity function. Emma, can you wiggle your toes for me? The physical therapist asked. Emma's face scrunched with concentration. We all watched her feet, hoping for any sign of movement. Nothing. It's okay, we'll try something else. Can you push down with your foot against my hand? Again, concentration. Again, nothing. They went through the full battery of tests. Sensation was absent. Emma couldn't feel when they touched her legs, couldn't tell if they were moving her ankle up or down when she closed her eyes. Motor function was absent. No voluntary movement at all. We'll reassess daily, the therapist said with professional optimism. Sometimes it takes time for nerve function to return, but I could see the fear in Emma's eyes. This wasn't temporary confusion or weakness. This was complete paralysis. That afternoon, Emma's parents made the decision to let Tyler visit. Both teenagers were in wheelchairs. Tyler because hospital policy required it for transport, even though he could walk. Emma because she couldn't. They met in a quiet family room on the pediatric floor. Both sets of parents were there, giving them privacy but staying close enough to provide support. Tyler and Emma looked at each other for a long moment, and then both started talking at once. I'm so sorry. This is my fault. They stopped, almost laughed, then tried again. You first, Tyler said. Tyler, none of this is your fault. You tried to stop me. You were the smart one. I was being reckless and stupid and you got hurt because of me. I'm so sorry. Emma, you didn't push me off the cliff. I chose to climb down to help you, and I'm glad I did, because you needed help. I just wish I'd been able to do more, been able to get you out of there safely. You got me rescued. The doctor said if you hadn't found help when you did, I might have died. You saved my life. But your legs, Tyler's voice cracked. Emma, I'm so sorry about your legs. Emma was quiet for a moment. Then she said, they might come back. The doctors say there's still a chance, and if they don't, I'll deal with it. I'm alive because of you. That's what matters. It was a heartbreaking and beautiful moment. Two kids who'd made a mistake, who'd paid a terrible price, forgiving each other and trying to find a way forward. After their meeting, Dr. Okoye pulled me aside. I want you to present this case at M&M next week. The clinical aspects, obviously, but also the human side. I think our staff needs to be reminded that our patients aren't just medical puzzles. They're people with relationships, with guilt, with fears, with grace. I've never presented a case at M&M, I said nervously. Then it's time you did. You were instrumental in both of these kids' care. You should be the one to tell their story. The M&M conference presentation was one of the hardest things I'd done during residency. Standing in front of attendings, residents, nurses, and medical students, presenting not just the medical details, but the human story of two teenagers whose lives intersected in tragedy. I walked through Tyler's presentation, the confusion, the repetitive speech, the focal neurological findings that indicated traumatic brain injury. I showed his CT scan, explained the treatment. Then I presented Emma, the massive multi-trauma, the spinal injury, the emergency surgery, the uncertain prognosis. But I also told them about the note, about Emma trying to protect her parents even when she thought she was dying, about Tyler fighting through his brain injury to deliver her message, about two kids who'd made a mistake but who'd also shown remarkable courage and compassion. The medical lessons here are numerous, I concluded. Pediatric trauma management, coordination with search and rescue, the cascade effects of injuries when patients try to help each other. But there's another lesson that's just as important. I paused, looking around the room. These weren't the head injury in Bay 4 or the spinal fracture in Trauma 1. These were Tyler and Emma. They're real people with families who love them, with futures that hang in the balance, with courage and fear and guilt and grace. When we reduce patients to their diagnoses or their injuries, we lose sight of that humanity. And that humanity is what makes medicine meaningful. After the presentation, several attendings came up to compliment my work. But the person whose opinion mattered most was Dr. Okoye. Well done, Noah. That wasn't just a good medical presentation. That was a reminder of why we do this work. 3 weeks after the accident, Tyler was discharged home with instructions for follow-up, physical restrictions until his arm healed, and clearance to return to school when he felt ready. Emma remained hospitalized, transferred to the rehabilitation unit. Daily physical therapy showed slow progress. She'd regained some sensation in her upper thighs, could feel pressure and temperature even if she couldn't feel light touch. But movement remained absent. Sometimes nerve function returns months after injury, her physical therapist explained to the family. We've had patients who showed no movement for 6 weeks and then suddenly started getting function back. Emma's young, she's healthy, her body has excellent healing potential. We can't give up hope. But I could see the toll it was taking on Emma. The daily disappointment when she tried to move her legs and couldn't. The reality sinking in that she might spend the rest of her life in a wheelchair. One afternoon, I stopped by her room during a break. She was alone, sitting in her wheelchair by the window, looking out at the autumn leaves that were now falling from the trees. "Dr. Reyes," she said when she noticed me. "Come to check on the girl who can't walk?" There was bitterness in her voice, so different from the brave optimism she'd shown initially. "I came to check on Emma Rodriguez, who survived a fall that should have killed her and who's fighting every day to heal," I corrected gently. "Fighting," she repeated. "That's a nice word for it. Mostly I'm just lying here waiting to see if my legs will ever work again." I pulled up a chair next to her. "Emma, can I tell you something? When you came in that helicopter, your vital signs were crashing. You were hypothermic. You'd lost huge amounts of blood. Your brain was swelling. Every medical indicator said you weren't going to make it. But you did. You fought for your life and you won. That fight isn't over, but you've already proven how strong you are. But what if my legs never work? What if I'm in this chair forever?" Then you adapt. You find new ways to do the things you love. You discover that you're more than just your ability to walk. "Easy for you to say," she shot back. "You can walk out of here whenever you want." She was right. I couldn't understand what she was going through, but I could witness it, could acknowledge her pain. "You're right. I can't truly understand. But Emma, I've seen your strength. I've seen your character. The way you tried to protect your parents even when you thought you were dying. The way you worried about Tyler before you worried about yourself. The way you're showing up for physical therapy every single day even though it's painful and frustrating. That strength is going to carry you through this, no matter what your recovery looks like." She was quiet for a long moment. Then she said, "My little sister Maya visited yesterday. She asked me if I was going to be able to go hiking with her again someday. I didn't know what to say." "What did you say?" "I told her, maybe, that I was going to try really hard to get better. But Dr. Reyes, what if I can't keep that promise? What if I'm lying to her?" "You're not lying. You're hoping. And sometimes hope is all we have. But Emma, whether you hike with Maya again by walking, or whether you find other adventures you can share with her, you're still going to be her big sister. You're still going to be the person she looks up to. That doesn't change." Emma wiped her eyes. Tyler sent me a card. He drew this picture of the two of us as superheroes. It's really dorky, but also kind of sweet. He cares about you. I know. He texts me every day asking how I'm doing. He says when I get out of here, he's going to take me to this indoor rock climbing place that's wheelchair accessible, like we're going to keep having adventures together. That sounds like a good friend. Yeah, she agreed softly. He is. 6 weeks after the accident, I was finishing up my emergency medicine rotation when I got a message to come to the physical therapy gym. When I arrived, I found a small crowd gathered. Emma's family, her physical therapy team, Dr. Okoye, Dr. Martinez, the neurosurgeon, and Tyler in his wheelchair with his parents. Dr. Reyes, glad you could make it, Dr. Martinez said with a smile. Emma has something she wants to show you. Emma was at the parallel bars, those long rails that people use to practice walking. Her physical therapist stood on one side of her, ready to catch her if she fell. Emma's been working really hard, the therapist explained. About 2 weeks ago, she started getting some return of motor function. Just little twitches at first, but then more. Yesterday, she stood up with support for the first time. Today, she wants to try something more ambitious. Emma looked at me, a mixture of determination and fear on her face. I'm not going to walk across the room or anything dramatic like that, she said, but I'm going to take a step, one step, and I wanted you to see it. She gripped the parallel bars tightly with both hands, bearing much of her weight through her arms. Her legs were shaky, the muscles atrophied from weeks of disuse, but they were holding her up. Then, with enormous effort, she lifted her right foot, moved it forward maybe 6 inches, set it down. One step. The crowd erupted in applause. Emma's mother was crying. Maya was jumping up and down. Tyler was grinning so wide his face looked like it might split. It's not much, Emma said, breathing hard from the exertion. I've got months of physical therapy ahead. The doctors say I might always have some weakness, might always need mobility aids for long distances, but I can move my legs. I can feel them. And someday, maybe I'll hike again. That was incredible, Emma, I said, genuinely awed. A few weeks ago, you couldn't move them at all. Now you're taking steps. That's not much. That's a miracle. Dr. Martinez says I'm one of the lucky ones, Emma said, that most people with my injury don't get this much function back. She says my age helped, and getting to surgery quickly helped, and maybe just being stubborn helped. Dr. Martinez laughed. I did say that. Emma's been our most determined patient. She never gave up, even when progress was slow. After the demonstration, as Emma rested in her wheelchair, exhausted but happy, Tyler wheeled over to her. That was amazing, he said. You're amazing. Thanks. Your arm's out of the cast now? He held up his formerly broken arm, now free of plaster. Yep, got it off last week. Still a little weak, but getting stronger. Physical therapy for both of us, I guess. Yeah, Emma agreed. Then, more seriously, Tyler, I've been thinking about what happened, about the mistakes we made, and I want to do something about it. What do you mean? I want to talk to other kids, at schools, at scout troops, wherever. Tell them our story. Tell them what happens when you ignore safety rules, when you think you're invincible. Maybe if they hear it from someone their own age, someone who lived through it, they'll make better choices than we did. That's a great idea, Tyler said. I'll do it with you. We can tell the whole story together. Even the embarrassing parts, especially those. That's what makes it real. Emma looked up at me. Dr. Reyes, would the hospital let us do something like that? Like a safety awareness program? I think the hospital would love that, I said. I'll talk to Dr. Okoye and our community outreach department. Emma, Tyler, turning your experience into something that helps others, that's incredibly mature and incredibly valuable. Over the following months, Emma and Tyler did exactly that. They developed a presentation about their accident, about the choices they made and the consequences that followed. They spoke at schools, at scout meetings, at youth groups. Emma's recovery continued slowly but steadily. She graduated from the parallel bars to a walker, then to forearm crutches, then to walking short distances without assistance. Her doctor said she'd likely always have some weakness, might need mobility aids for long distances or rough terrain, but she'd exceeded everyone's expectations. Tyler's physical injuries healed completely, but he continued to see a counselor to process the trauma and guilt he'd carried. His parents said he'd become more cautious, more thoughtful about risks and decisions, but he'd also become more compassionate, more attuned to others' struggles. The two remained close friends. I'd see updates sometimes on social media, photos of them at the adaptive rock climbing gym Tyler had mentioned, or at school events, or just hanging out. They'd bonded through trauma in a way that created an enduring connection. One day, about 4 months after the accident, I received a card in my hospital mailbox. Inside was a photo of Emma actually standing without support, at the base of a small hill, arms raised in triumph. On the back, she'd written, "Dr. I. Reyes. This is the first hill I've climbed since the accident. Just a small one in the park near my house, but I made it to the top, with lots of breaks. Tyler was with me, of course. We took a picture from the summit and everything. I wanted you to know that I'm going to be okay. Not the same as before. I'll never be exactly the same, but okay in a new way. I'm learning that strength isn't just about your body. It's about your spirit, your determination, your willingness to keep going even when things are hard. Thank you for taking care of me when I was broken. Thank you for seeing me as a person, not just an injury. Emma." I kept that photo in my locker, next to Gerald Morrison's sobriety chip from a previous case. They were reminders of why I'd chosen medicine. For moments like these, when patients don't just survive but thrive, when broken becomes rebuilt, when tragedy transforms into triumph. At my 6-month residency evaluation, Dr. Okoye noted in her assessment, "Dr. Reyes demonstrates not only clinical competence, but genuine compassion for his patients. He sees them as people first, diagnoses second. This quality will make him an exceptional physician." I thought about Tyler arriving in the ER, confused and injured, desperately trying to deliver a message to someone we didn't know. How that cryptic, "Tell her I'm sorry," had launched a race against time to find Emma. I thought about how easily it could have ended differently, if Tyler had been found just a bit later, if the search had taken longer, if Emma's injuries had been just slightly worse. Medicine is full of these narrow escapes, these close calls where everything hangs on timing and luck and the determination of rescuers and the resilience of the human body. But it's also full of moments like Emma's first step, like Tyler's relieved tears when he learned she'd survived, like 2 teenagers who made terrible mistakes and suffered terrible consequences, but who chose to turn their tragedy into teaching, their pain into purpose. That's the privilege of being a doctor, witnessing these moments of human resilience and grace, being present for the worst days of people's lives, but also being there when they fight their way back from the edge. Emma would probably never hike that exact trail again. The Park Service had actually closed the access to that overlook after the accident, deeming it too dangerous. But she'd find new trails, new adventures, new ways to explore the world, and Tyler would be right there with her, the friend who'd never stopped trying to deliver her message, who'd never given up on her. Some cases stay with you, not because of their medical complexity or their unusual presentation, but because of the people at the center of them, because of what they teach you about courage and forgiveness and the human capacity to heal, not just physically, but emotionally and spiritually. Tyler and Emma taught me that. 2 14-year-olds who made a mistake, paid dearly for it, but refused to let that mistake define them, who chose growth over guilt, purpose over paralysis, hope over despair. That's the kind of medicine I want to practice, the kind that sees patients as whole people, that acknowledges their struggles and celebrates their victories, that recognizes that healing is about more than just repairing bodies. It's about supporting spirits. As I finished my emergency medicine rotation and prepared to move to my next assignment, I thought about how much I'd learned in those 3 months, about trauma and triage, about quick decision-making and resource coordination. But most of all, I'd learned about listening to the cryptic messages patients give us. "Tell her I'm sorry" had seemed like confused rambling from a head-injured teenager, but it had been a vital clue, a desperate plea, a message that needed delivering. And by listening, by taking it seriously, by working to understand who she was and why she mattered so much, we'd saved a life. Sometimes the most important thing we can do as doctors is simply pay attention. Listen to what patients are saying, even when it doesn't make immediate sense. Look beyond the obvious diagnosis to the story underneath. See the person, not just the patient. That's what I'd learned from a confused Boy Scout with a broken arm and a desperate message, and it's a lesson I'll carry with me for the rest of my career. Sometimes the most important messages are the ones that don't make sense at first. Sometimes saving a life means listening to words that seem like confused rambling, but are actually desperate pleas. And sometimes the greatest act of healing is helping patients transform their worst moments into their greatest sources of strength.